Yes, I am.
There you go. So I'll get you to fill out the initial screening form. Just head your way to the consult room. I'll be with you shortly.
Thank you. That's me finished the patient questionnaire.
Awesome, thank you. So that was just the initial screening test. So are you taking any other medications at the moment?
No.
Any other medical conditions?
No.
Cool, awesome. So I'll just go through a few other questions. This is just to ensure that everything is safe for you, and then we'll go through the rest of the weight loss consultation.
Perfect.
Cool. So initially I'll just be checking your physical assessment and also just asking you a few questions on your lifestyle at the moment, just to ensure that everything is up to date. And how many hours per night do you get sleep?
About 6.
There is a relationship between sleep and obesity as well, so it's just important to consider these things as well. So roughly, adults need about 8 hours of sleep. Cool. So just from my initial checks, you do meet the criteria for a Wegovy injection. We'll go through some of the side effects and everything else a little bit later on. Now you mentioned you don't have any other medical conditions.
No.
I'll just go through quickly of some certain family history conditions that can affect you using the medication.
Okay.
Do you have any history of thyroid carcinoma or endocrine syndromes?
No.
Do you have a history of severe gastrointestinal symptoms?
No.
Any issues with your eyes like retinopathy?
No.
Do you suspect you're allergic to any sort of injection such as the Wegovy, which is a GLP-1 injection?
No.
Do you have sustained elevated heart rate?
No.
Do you have any issues with congestive heart failure?
No.
Are you diabetic or suffer from any sort of diabetic stomach issues?
No.
Do you have any pancreatic issues or gallstones?
No.
Do you have hepatic or liver issues at all?
No.
You mentioned you weren't taking any other medications?
No.
currently? Are you currently taking oral contraceptives at all, or anything that affects the way the medicine is absorbed from your gut?
No.
Do you have any mental health concerns? Do you feel low in mood at all at
No.
times? Cool. I'm just going to double check a couple of health statuses for you. So we're essentially going to measure how well your kidney functions, looking at the eGFR. And also we're going to check your diabetic status, which is looking at how much sugar is in your blood. That's something that I'll do just online, and I'll fill out these details based on the NHI that you gave me.
Okay.
Cool. So based on what you've said to me, you do apply for the semaglutide injection, which is the Wegovy injection. Everything that you've told me here has met the criteria for you to be able to use it, but just ensure that you're using your actively exercising every day, at least about 250 minutes per week. You also need to continue with your dietary habits and make sure that those are on, you keep on top of those. So just with this medication, because you are initiating it, you do need to contact the pharmacy within 7 days. We'll reach out to you, but we'll just go over some of the side effects that you have, make sure everything's working fine, and then it's safe for you. Now is about a 4-week pack, so each injection is for 1 week. It's best recommended that you use it on the same day each week. But that means you do need to come back to see us in about 4 weeks' time.
Okay.
So if there's any side effects during the course, just reach out to us.
Perfect.
Cool. And as mentioned before, the weight loss injection is to be used with dietary and lifestyle modifications as well.
Yes.
I'll go over some of the risks and the benefits of this medication. And are you happy to consent to taking this?
Yes, I am.
Cool. So once we've provided this medication for you, we will just notify your GP as well, so they're aware. Sometimes in instances, your doses of other medications might need to change. If you do start taking a new medication, or if you do fall pregnant, just immediately let us know, because you can't use this medication while you're pregnant.
Okay, no problem.
So today's Thursday, we'll give you a phone call next Thursday just to check everything's okay, and then we'll book in an appointment in about 4 weeks' time as well.
Perfect.
I'll just get your consent just over here.
Okay.
Information sheet just for you to keep. I'll briefly go over a couple of things just so you're aware, and you can ask any questions if you need to.
Yes.
So some of the side effects that you can experience are GI symptoms. That's very common, and a bit of nausea as well. So the best way to deal with this is to have smaller meals and more often. If you do have really severe side effects that's lasting longer than 7 days or at least a couple of weeks, just come and contact us. You do have to eat a lot more fruit and vegetables just to balance out your lifestyle factors.
Yes.
And just make sure that you're choosing whole foods as well. One of the side effects that you can experience is dehydration, so make sure you're having plenty of water as well. Often good to set goals when you are exercising as well. You mentioned you're doing about 45 minutes per day, which is great. So when you're taking the medication, ensure that you set goals of how much weight you would like to lose. You shouldn't really expect more than about half a kg to a kg every couple of weeks or so.
Okay.
So what I'm providing for you is one box. This is the 0.25 milligram box. There's about 4 pens, as I mentioned. Each pen is used once a week, and it's on the same day each week. You can administer it either on the thigh or just in your lower abdomen region, but just make sure that you're rotating the site each time you administer it, just so you're not getting a build-up of scarring tissue.
Okay.
So the box is meant to be stored in the fridge. So do you have an appropriate fridge that you can store it in?
Yes, I do.
So once you've taken it out of the box, it can last for about 6 weeks outside of the fridge, but the rest will need to stay in the fridge.
Okay.
So as I mentioned before, you need to take the dose once a week on the same day. So if it's more than 2 days until your next dose, if you do miss a dose, take it as soon as possible. But if it's less than 2 days until the next dose, skip it and wait for your regular day.
Okay.
Cool. If you do miss more than 2 weeks, suppose, just make sure you talk to your pharmacist or GP.
No problem.
Some of the side effects that are rare, but just make sure you mention it to your GP if you're experiencing these. If you have any pain in your upper tummy or any sharp pain in your stomach, just stop immediately, contact the pharmacist or your GP. Or if you feel a bit of a fast or irregular heartbeat, just give us a call.
Okay.
As I mentioned before, it can cause a bit of dehydration, so you might experience a dry mouth and a bit of dizziness as well, potentially mood changes as well, so that's something to keep an eye out for. If you're feeling down, just make sure you contact us.
Yes.
And if you were to become pregnant, or if you're planning a pregnancy, you'll need to come and contact us, because you can't take the medicine while you're pregnant. Just some additional products that can help you with your side effects. Just make sure you have rehydration, hydrolyte rehydration with you. That's just going to help prevent your dehydration. You can try multivitamins or have digestive support as well.
Perfect. Good.
I'll give you this patient information sheet just so you have it as a reference at home.
Perfect. Thank you.
Amazing. Thank you.
Thank you.